Welcome to Salad with a Side of Fries. I'm your host, Jen Trepic, talking wellness and weight loss for real life. We're here to clear up the myths, misinformation, bad science, and marketing to teach you how to eat and how to cheat. Are you ready? I'm having salad with a side of fries. This week, we're talking about non-alcoholic fatty liver disease. And I will say now it actually has a new name, so we'll get to that in a second. But I've had this topic on my list for the longest time because it is truly an epidemic, kind of growing into a pandemic. But I want to share some stats with you. So from the NIH, among type 2 diabetics from 1989 to 2018, the global prevalence was 55.5% for non-alcoholic fatty liver disease and 37.3% for non-alcoholic steatohepatitis and 17% for advanced fibrosis. Okay, you don't have to know what all those things are. We'll get to it. A recent study using the Markov prediction model reported that non-alcoholic fatty liver disease is projected to increase by 21% from 83 million in 2015 to 101 million people in 2030. 15 years from 83 million to 101 million people. And according to the Liver Foundation, about 100 million people, so about 25% of the United States, are estimated to have non-alcoholic fatty liver disease. It is the most ordinary form of liver disease in children and has more than doubled over the past 20 years. So needless to say, this is an incredibly important health topic for us to discuss. Now, I mentioned it has a new name. So non-alcoholic fatty liver disease, NAFLD, is now MASLD, or metabolic dysfunction associated steatotic liver disease. Fundamentally, what it is the buildup of extra fat in the liver, so fat in liver cells, that's not caused by alcohol. So oftentimes, or traditionally, this was seen in the liver of people who drank a lot of alcohol, right? What we would say is, somebody who's an alcoholic often developed fatty liver disease. This is non-alcoholic fatty liver disease. So extra fat in the liver cells, not caused by alcohol. Now, if you remember, our very first episode of Salad with a Side of Fries was called The Truth About Alcohol. And so in there, we talked about what happens with the liver and why that's the case. So you can dig into that if you want to. But for today, with non-alcoholic fatty liver disease, we want to understand. So typically, the liver does contain some fat. We cross the line from normal amounts of fat in the liver to disease if more than 5 to 10% of the liver's weight is fat. And what happens is that when that's the case, it causes the liver to swell, it becomes damaged, and then we end up with impaired function. The more advanced form of non-alcoholic fatty liver disease, or NAFLD, is NASH, which is non-alcoholic steatohepatitis, now called, as we said before, metabolic dysfunction associated steatohepatitis. So here's the shortcut to remembering this, right? It's metabolic dysfunction associated steatotic liver disease if there's fat but no inflammation or tissue damage. It progresses into metabolic dysfunction associated steatohepatitis if there's fat, inflammation, and liver damage, right? So the interesting thing about this new name is that it actually gives us clues as to what causes the issue, right? Another NIH paper estimated that 25% of people in the United States have non-alcoholic fatty liver disease and up to 70% of people with type 2 diabetes, though it often goes undetected or undiagnosed. So this happens for a couple reasons. And these are sort of my logical brain thinking through the reasons. First is diagnosis requires sometimes an invasive liver biopsy or like CT scans and blood work also. And the other is because non-alcoholic fatty liver disease is like a comorbidity of obesity, type 2 diabetes, metabolic syndrome. And so with that, it's certainly possible for those in smaller bodies to have non-alcoholic fatty liver disease too, right? It's not just about this body shape or size, and it often goes undiagnosed and undetected. So the research so far as what causes it, yes, carrying extra body weight, high blood sugar, high cholesterol, high blood pressure. Researchers also seem to agree that essentially obesity is the most common cause of this disease, of non-alcoholic fatty liver disease. But I think why it's important for us to talk about is the prevalence is one reason, right? The other is that it often goes undiagnosed. And when that happens, right, we don't address it. The more severe or progressed form, which means that there's inflammation and tissue damage, right? Potentially like scarring of the liver, which would be called fibrosis. That can lead to compromised liver function, potentially permanent damage. That's often called cirrhosis, right? If you've heard of cirrhosis of the liver. And then there's potential links to liver cancer and maybe even liver failure requiring a transplant. So I know that feels pretty extreme. It's really just truly a function of our nutrition and lifestyle choices. And so when we look at the risk factors, and I think they bear repeating because I want everybody to sort of be on the same page on this so that we really understand and we can logically deduce the common underlying causes, right? So risk factors are obesity, insulin resistance, metabolic syndrome, type 2 diabetes, high cholesterol, high triglycerides. Other conditions that may raise your risk are also polycystic ovarian syndrome, sleep apnea, and hypothyroidism. So we see why this is so prevalent. Like all of these things are things that we're seeing all the time. So you're probably now thinking, how do I know if this is an issue, right? If this is so silent, right, how do we know? Part of it is people can live with excess fat in their liver without damage to the liver. It's not like something happens and we're all of a sudden going to have these symptoms. Symptoms can take years to show up. And then some symptoms, so think like fatigue, abdominal pain, usually like the upper right area, weakness, weight loss, jaundice, spider-like blood vessels on your skin, long-lasting itching. Some of these symptoms, right, are also indications of other things. When it hits the point of cirrhosis, symptoms can be fluid retention, internal bleeding, muscle wasting, confusion. Now, before you go freaking out, right, many of these symptoms, like I said, can also be connected to other things. So, of course, we want to consult our healthcare providers. We want to ask questions, but I want this on everybody's radar because it often goes undiagnosed. And the diagnosis process is a little bit invasive, but we want to start asking the questions. The other thing is, because you listen to Salad with a Side of Fries, you are already ahead of the game, right? We talk about metabolic health all the time. So what we want to understand too about non-alcoholic fatty liver disease, or MASLD, or metabolic dysfunction associated steatohepatitis, or steatic liver disease, prevention is best. And I think that's actually really good news because lifestyle changes can control or reverse the fat buildup in the liver, right? So how do we do this? Fat removal, or as conventional language would say, fat loss, removing body fat through quality nutrition is key. Now, I want to add some details and nuance to this here, right? Full disclosure, the medical community just says weight loss, but we all know that some approaches to quote unquote weight loss can create more muscle loss than fat loss or fat removal. So, I'm just more particular in the language, right? Also, avoiding the foods that create the challenge for the liver. So think ultra-processed foods. We actually have a nutrition nugget on UPFs, or ultra-processed foods. We want to avoid foods that have excess sugar, There was a 2017 study that walked through how this happens, that sugar we eat can contribute to fat buildup in the liver. Specific foods to have on your radar are the high glycemic foods that we talk about minimizing all the time. So think baked goods like cakes, cookies, donuts, pastries, pies, right? Ice cream, candy, sugary cereals, sugary drinks. That could be soft drinks or even sports drinks, right? Sugary drinks, and even sweetened dairy. Like think about all those flavored yogurts, right? So sweetened dairy can also contribute to this. Now, knowing how to read labels and identify sugar is critical. So you can go back to our many episodes on reading labels for practice on this, and our episode from earlier this fall about the sugar-free challenge that might help you here. Another aspect of prevention and lifestyle choices to support a healthy liver include managing cholesterol and triglycerides. So research shows that bodies with non-alcoholic fatty liver disease may have a harder time managing cholesterol on their own. Now, again, if you listen often, you also know that sugar is a major factor in cholesterol and oxidized cholesterol. So again, right, it's all connected. Now, nutritionally, we're going to prevent and heal by choosing whole, real foods, clean, lean protein, fiber-rich fruits and vegetables, quality fat, right? Especially if we're looking to repair, quality fat only, and then truly whole grains. So think everything that we talk about for blood sugar balance applies here. And then, of course, increasing activity levels is also really helpful. Now, there is some interesting research that coffee may be helpful here. I will say, remember that caffeine can impact our sleep. We must sleep to help the body detoxify. One of the major jobs of the liver is detoxification. So the caveat from me on this research on the coffee is note the timing of your coffee. Remember, no coffee before food in the morning. Keep your coffee to earlier in the day. And then with this research, though, it might take like 2 to 3 cups of coffee per day to get those liver health benefits. So you decide for you what's going to work there. Limiting alcohol, of course, right? We know that alcohol burdens the liver. Other things that can irritate the liver, which we'd want to minimize, would be like over-the-counter medications, taking too many pills or things that the body has a hard time breaking down. And then with that said, some strategic supplementation can be helpful here, like high-quality omega-3 fatty acids, vitamin E may be helpful. Vitamin E acts like an antioxidant and may reduce inflammation. And then there are some herbs and botanicals that in research support liver health. So some that I like, turmeric, or I would prefer curcumin, that's the active ingredient in turmeric. Milk thistle, green tea, ginger, garlic, all have some great research connected to liver health. I'll put links to my favorite omega-3, curcumin, and liver support supplements in the episode notes for this bonus episode so that you have those there, easy to find. And again, I'm going to say it again, as always, consult your healthcare provider. Maybe you want to see a liver specialist. On the whole, this is about awareness. Awareness of non-alcoholic fatty liver disease is so important because considering the prevalence, it's kind of hard to believe that it's not really discussed or discussed more. But now you know, and now you get to make choices based on that. So there you have it, friends. Non-alcoholic fatty liver disease. Well, as always, everybody, I'm your host, Jen Trepeck. Connect with me on Instagram or all social media. I am at Jen Trepeck, JenNTrepeck. Website is asaladwithasideofries.com. Pick your platform, send a message. I truly love hearing from you. This is the easiest way to learn more about working with me as your health coach or submitting questions or topic ideas too. And friends, if you are not already, join our membership program by going to glow.fm/saladwithasideofries. This shows your support for this podcast, this community, and most importantly, it supports your health. You'll get this week's recipe for the sheet pan healthier chicken parm and your quarterly live Q&A, which is just you and me for a one-on-one. Well, friends, that's it for today's episode of Salad with a Side of Fries. Congratulations for making yourself and your health a priority. Thanks so much for joining us. Be sure to click subscribe or follow on your favorite podcast platform. Share us with a friend, and we'll be back next week. Always remember, you deserve it, and you are worth it. Happy healthy.